Welcome to the image analysis of the ankle. Image analysis guidelines of the AP projection for the ankle state that the medial mortise should be demonstrated as open. The tibia will superimpose one half of the distal fibula. The anterior and posterior tibial margins should be demonstrated adjacent to the medial malleolus. The tibio-talar joint space is demonstrated open. The tibio-talar joint is demonstrated at the center of the exposure field, and the distal fourth of the tibia, fibula, and the talus, and surrounding soft tissue should be included within the exposure field. When there is rotation and an AP projection of the ankle, you immediately want to turn to look for the medial mortise and determine whether it is open or not. If it is not open, then there is some type of rotation. And so how do I determine that rotation? You're going to look at the relationship of the tibia and fibula primarily. In external rotation, the tibia will superimpose more than one half of the fibula, as demonstrated here. Okay, and also you can look at the talus's relationship with the tibia. The anterior tibial margin will superimpose the talus, closing that medial mortise. In internal rotation, you're going to again look at that tib-fib relationship and that talus tibia relationship. That like I said, internal rotation, the tibia will superimpose less than one half of the fibula, okay? And the talus superimposes the posterior tibial margin, closing that medial mortise. So in this AP projection of the ankle, we want to first determine, do we have all our anatomic structures, which we do. And next we want to determine whether we have a true AP projection. And how do we do that? Well, we're going to look for that open medial mortise. That medial mortise is not demonstrated as open, so therefore we might have some rotation issues. Looking at this projection, we've determined that the medial mortise is obscured and that looking at the tib-fib relationship, the tibia superimposes more than one half of that fibula, and the anterior margin is tibial margin is lateral to the posterior margin. This indicates that the ankle was externally rotated. In order to correct this imaging, you have to internally rotate that ankle to get a true AP projection. In our next AP ankle practice analysis, we're again going to look for that medial mortise. If it is open, you have a good image, but unfortunately in this image our medial mortise is again closed here, okay? So therefore we have some rotation issues. Next we're going to look at that tib-fib relationship. And it looks to me like less than one half of the fibula is superimposed by the tibia. And that's indicating to me that the ankle was internally rotated, almost like a mortise view. Therefore, we need to externally rotate the ankle to get a true AP projection. Let's move on to the AP oblique projection with medial rotation or internal rotation. We're going to start with the image analysis guidelines for the mortise view, which is that 15 to 20 degree AP oblique. Guidelines state that the distal fibula should be demonstrated without talar superimposition, demonstrating that open lateral mortise. The lateral and medial malleoli should be demonstrated in profile, and the tibia will superimpose 1/4 of the distal fibula. For the AP oblique projection medial rotation with 45-degree obliquity, guidelines state that the lateral mortise is open with differing degrees of mortise narrowing. Fibula, it should be seen without tibial superimposition. The tarsi sinus is demonstrated. The tibio-talar joint space is open and centered to the exposure field. In both projections, whether it's the 15 to 20 degree or 45-degree oblique, the calcaneus should be visualized distal to the lateral mortise and fibula, and the distal fourth of the fibula, tibia, the talus, and the surrounding ankle soft tissue should be included within the exposure field. When trying to determine rotation in the AP oblique ankle mortise view, obviously we're going to look to see if our mortise is open. When looking at the first projection, you can see that the lateral mortise is closed. Therefore, we have some rotation issues. In insufficient rotation, the tibia will superimpose more than 1/4 of the fibula. In addition, both the lateral and medial mortise joint spaces here will be demonstrated as closed, and they should be demonstrated as open. In excessive rotation, internal rotation, the tibia will superimpose less than 1/4 of the fibula again, but the medial mortise is only demonstrated as closed. Typically, the lateral will start to open. Let's take a look at our mortise practice analysis. We know that in this projection, we are looking for an open joint space, okay? And in this projection, you can see that the lateral mortise here is closed, okay? The medial looks open, but what you want to determine here, are we insufficiently rotated or excessively? In this case, I would say we are insufficiently rotated because the lateral mortise is closed and the tibia superimposes more than 1/4 of that fibula. In order to correct this, we want to internally rotate the leg until the ankle joint, the intermalleolar line, is parallel with that IR. I have one practice analysis for the 45-degree oblique projection. When taking a look at this practice analysis, we can see that the tibia is superimposing just a small portion of the fibula and the tibio-talar joint space is closed. This should tell you that your leg and ankle were insufficiently rotated. Also, the calcaneus is obscuring that distal aspect of the mortise joint, or that lateral mortise, sorry, and the distal fibula. The foot is in plantar flexion. We need to dorsiflex that foot. So in order to correct this image catastrophe here, we need to internally rotate that ankle until it's at 45 degrees and dorsiflex that foot in order to correct this imaging. Please proceed to part 2 for the lateral ankle projection image analysis.